This is Pet Life Radio. Let's talk pets.
To ER Vet on Pet Life Radio. I'm your host, Dr. Justine Lee, and I'm a board-certified emergency critical care veterinary specialist and toxicologist. Thanks for joining us. Today, we're going to be talking about something that all you dog owners, especially all of you dog owners of Labrador Retrievers and Golden Retrievers, must tune in on, and that's the growing problem of obesity. It's a really important topic, so please don't tune away. This is a really important one that could actually add an average of 1.4 years onto your dog and maybe cat's life. And I'm really excited to be speaking with board-certified veterinary nutritionist, Dr. Martha Cline. We'll be right back after these messages.
Take a bite out of your competition. Advertise your business with an ad in Pet Life Radio podcasts and radio shows. There is no other pet-related media that is as large and reaches more pet parents and pet lovers than Pet Life Radio. With over 7 million monthly listeners, Pet Life Radio podcasts are available on all major podcast platforms, and our live radio stream goes out to over 250 million subscribers on iHeartRadio, Odyssey, TuneIn, and other streaming apps. For more information on how you can advertise on the #1 pet podcast and radio network, visit PetLifeRadio.com/advertise today.
Let's talk pets on PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. Really excited to be talking with Dr. Martha Cline. Martha, thank you so much for joining us today. Love what you do and can't wait to do today's radio show.
Yeah, I'm so happy to be here. Thank you for having me.
All right, just so our pet owning population knows a little bit about you, do you mind just telling us about where you trained, where you did your veterinary school, where you did your residency program in nutrition, and what the difference is between a regular veterinarian and one who's board certified in veterinary nutrition?
Well, thank you so much, Justine. So I went to the University of Tennessee College of Veterinary Medicine and graduated with my veterinary degree. After that, I went on and did an internship, and then I returned to the University of Tennessee to do my small animal clinical nutrition residency. And at the end of that, I became a diplomat. I'm a board certified veterinary nutritionist.
Wonderful. Thank you so much. You know, it's so important because I know there's always questions about what to feed your pet, how much to feed. And so we're going to talk about some of that, but it should be no surprise to pet owners that unfortunately obesity is a major problem in our four-legged friends. And the Association for Pet Obesity Prevention recently released the results of their latest study on obesity prevalence. And it revealed that 59%, that's almost 3 out of 5 dogs, are overweight or obese. At the same time, Dr. Cline, you have some information that would tell us many dog owners simply don't realize that their pets are overweight. Do you mind just giving me some information on this?
Yeah, so the ProPlan Veterinary Diets Weight Survey, those results actually found that 1 in 5 owners acknowledged that they had an overweight dog, which is in contrast to what we can see with the Association of Pet Obesity Prevention. And I actually think that really reflects a lot of what I see in clinical practice. There's a lot of pet owners, and I'm sure you've experienced this as well, is that they come into the clinic and they have a pet owner that we would recognize is having excess body weight, but the pet owner maybe doesn't actually recognize that that is the case. Interestingly, there was a study that was published last year in 2022 looking at veterinarian owner perception about pet weight. And pet owners actually considered weight to be a really valuable health indicator. But what was really interesting is that they put more value on underweight versus overweight. And so it does present a challenge for me as a veterinarian in the exam room when I'm practicing and seeing my nutrition cases, because there is often a disconnect, I think, between pet owners and having that recognition. Now the the normal. If we're talking about 59% of dogs, that's the majority of dogs. So, what is normal now for them? So normal and ideal weight are not the same.
Thank you so much for that information. I know that even decades ago, we started something called a body condition score, or a BCS. And Purina was actually instrumental in creating the Purina Body Condition Score Guide, where we all learned on a system of 1 through 9 how to, quote, grade a dog or cat. And don't worry, it doesn't mean you failed, but it's just basically letting us have a numeric visualization of scoring your pet. So 9 would be really, really obese. 1 would be emaciated and really thin. And you really want your pet to be, I'm going to say, a 4 to 5, 4.5.
That's right.
And I always say to Labrador Retriever owners, if you own a Labrador and someone comes up to you and says, "Oh, your lab is so skinny," that means your lab is perfect, right? That is like a 4 out of 9 body condition score. So do you mind just giving us some clues besides physically feeling the ribs? Well, what can a dog owner do to tell if their pet is overweight? How do we tell?
Yeah. So one thing for pet owners to recognize about the body condition scoring system is that this is a validated scale that correlates with body fat percentage. So when your veterinarian is doing a body condition score, and maybe in the exam room of some of the vet hospitals that you've been in, you've even seen these charts hanging on the walls, but the Purina scales that were developed, they correlate with body fat percentage. And the 9-point scale has been endorsed by the World Animal Veterinary Association and the American Animal Hospital Association for universal adoption. So this is a pretty universal scale that a lot of veterinarians are going to adopt into practice. And so when I am doing a body condition score system, sometimes people will call it like a healthy hug. But I also sometimes when I'm demonstrating to pet owners is I'll even use like the palm of my hand. So I can't feel the bones when I feel across the palm of my hand. It's like feeling across the ribs. You don't want to do that. But if you flip your hand over and you hold your hand flat and you feel along the back of your hand, you can feel those bones. And that's really how we want the ribs to feel. So you're going to feel along the ribs and you should be able to feel them, not necessarily see them. Sometimes in really lean dogs and ones that have short hair, sometimes not all of the ribs, but maybe the ones in the back. And then looking at them from the top, you want to make sure that they have a waist, from the side that they have a tuck right after those last ribs. You can also feel along their back and feel for those hip bones. You don't want them to protrude, but you want to be able to feel them. Sometimes we can't always feel them. I'll feel along the tail base and try to feel if there's a little dimple above the tail. There shouldn't be one. But those are some of the ways that we're going to assess for the body condition scoring system. So again, if you're in the exam room and you see those charts on the walls, there'll be some descriptors written beside that, but that's not a made up scale. It is actually something that is validated to correlate with a pet's body fat percentage and is used in a lot of scientific research.
Wonderful. Thank you for that information. I will sadly say that when I work with new veterinary graduates or veterinary students, they often are so used to seeing overweight and obese animals. When I'm looking through the medical records, they'll say, "Oh, this dog or cat is a 5 out of 9 or 6 out of 9." I'm like, "No, it's actually a 7 to 8 out of 9. It's really, really overweight. It's really obese." We're just so used to it. And, I'm going to ask you a little bit about a long-term 14-year Purina study that was done a little bit later. But again, really, really important that you are feeling the sides of your pet, your dog or cat every single day, right? It's not just a matter of feeding the bowl, it's feeding the pet. I know that when I run with my dog more in the spring and summer, that I need to feed my dog more because I can literally feel his ribs through his coat because he gets a lot more exercise. And it's a total normal Minnesotan thing where like pets and humans gain at least 5 pounds during the winter because we have 6 months of winter. So I actually feed less in the winter for both of my dogs. So again, it's not a matter of just scooping out the same amount every day. It's a matter of actually, petting your pet and feeling and seeing if they have that tuck in their waist, whether or not they have that fat pad over their tail area. So important. One of my favorite words of advice that I always give to dog owners, especially if they have a purebred, is to go to the AKC website. And the main reason why is because if you go to the AKC website, you will see what the classic golden retriever or the classic Doberman Pinscher or whatever breed you may have, they will actually list what the classic weight is. And a lot of people, like the average Labrador retriever that I see come in, they're usually 88 to 90 pounds in the ER. And if you look on the website, it's actually 75 pounds, right? So that's a really good general guideline of what your ideal breed's weight should be. So great resource to be able to look at that. So again, really important information when it comes to your own health, your pet's health, because we want them to live longer. All right. Now, I know that I previously mentioned it, but do you mind just giving me a short summary of what that Purina 14-year study looked at in dogs?
Yeah, so sometimes we'll call it the Purina Lifespan Study, but this was a really pivotal paper that was published just for veterinary nutrition in general. It is a study that looked at 48 Labrador retrievers that were split into two different groups, and they were followed over their entire life. So this study was about 14 years long. And what they did, they had two different groups. So one group was the control group of dogs, and then the other group, they were fed 25% less than their matched pair over the course of their entire lifetime. And so they were called the feed restricted group. And when Purina looked at the body condition score, so the mean body condition score between the ages of 6 to 12 years of age, the dogs that were in the feed restricted group, so the 25% less, they were about 4.6. So that would be ideal. So 4 out of 9 would be considered ideal. And then the dogs that were in the control group were about 6.7, so between 6 and 7. So that would be what we would classify as overweight. So one of the things that I always really emphasize is that this is not an obesity study. This is a overweight dog study. So now the results that they found, I think, are really important because as a veterinary nutritionist in the exam room, when I'm talking to owners and I have clients and they're like, what is the one thing that I can do to help my dog live as long as possible and have the best quality of life? And one of the things that I'll tell them is the best thing you can do, and we actually have prospective evidence to show, is by keeping them lean. And again, it's not just in the overweight category or compared to obese. This is looking at dogs in the overweight category compared to lean dogs. So the dogs that were in the feed restricted group, their median lifespan, so the time when half of the dogs had passed on and half of them were still alive, was 13 years compared to 11.2 years in the control fed group. So it's almost 2 years of extra life that these Labradors got. Some of the other really important findings is that the dogs, when we looked at osteoarthritis, so these were Labradors, so osteoarthritis is going to be one of the most common things we're going to see in these dogs, but the prevalence and the severity of osteoarthritis was significantly decreased. So the time that these dogs needed treatment was 13.3 years versus 10.3 years. So almost a delay of 3 years of needing treatment for that. And then just chronic diseases in general. So if we just group every single chronic disease in a category, it was 12 years versus 9.9 years. So almost 2 additional years. So it's not only the lifespan benefit, but it's also treatment for chronic disease, treatment for osteoarthritis. And a lot of those things correlate with quality of life in these animals. And so that's one of the things I really talk to owners about, because they'll come to me and they'll be like, what is there a supplement I can give? Is there like a very specific diet that I can feed? What is the like one best diet for all animals? And well, newsflash, there's lots of really good diets out there, and not one animal needs the same thing as the other animal. But the one thing that I would say translates across the board is trying to keep your dog lean.
Thank you so much, Dr. Cline. You just answered my next question about like overweight and obese body conditions putting a pet's physical health at risk. And again, we know based off that study that excess weight can really have a negative effect, not only on the health in terms of osteoarthritis and quality of life, but it could potentially have a negative effect on the relationship between dogs and their owners. What can you tell us about that?
Yeah, so when we look back at the ProPlan Veterinary Diet Survey, 92% of the owners that had dogs with excess body weight, they were sad that their dogs can't participate in their different activities. And so a lot of these owners did report, their pets having less energy. They would tire more easily after various activities. They have trouble climbing the stairs, which is a common complaint that I've heard in clinical practice, or they're just less engaged and less playful. And so that's something too, that a lot of these interactions really play into the human animal bond. And that a lot of pet owners, and I've heard this many times. I've done a lot of successful weight management programs with pet owners, and it does take a lot of work. It's not as simple as just, I'm going to give you recommendations on day one and see you later. I hope it goes well. So there's a lot of maintenance that goes along with working with your veterinarian and working with the veterinary team with helping your pet achieve a more ideal weight. But I think one of the things that I've gotten back more than anything from feedback is just how much more engaged the pet is. Pet owners will often talk about their dogs acting like a puppies again and being able to just engage more with the family and participate more with the family.
So important. Again, really important that pet owners recognize when their pets are overweight, just because we know the impact, again, not only because of the health impacts, but because of that effect on the human animal bond. Now, if owners know that being overweight makes their dogs more sedentary and less playful, or arguably less happy, what do you think the barrier is? Like, why don't they take action?
Yeah. And there's something we'll call readiness to change. And we talk about it a lot of times with nutrition recommendations. And this really goes into play with weight management and owners, one, recognizing that their pet has excess body weight, and not only recognizing it, but then also being ready to make those changes. And when clients are ready to make those changes, our pet owners are ready to make those changes, it's really important for the veterinary team to be prepared and engaged with those pet owners and to provide specific recommendations for them that not just include the main diet, but also treats and exercise recommendations. One of the biggest things that I have found that a lot of owners really feel guilty about not giving their pet food or as much food. And what's interesting about the ProPlan veterinary diet survey is they actually found 75% of those owners that had overweight dog, even though a lot of those owners recognize that it's a problem, but they actually feel really guilty about when their pets seem hungry. And so from a clinical perspective, one thing that I'll talk to pet owners about is how to manage begging behaviors, because this can be really stressful for the owner. And they perceive it as also being really stressful for the pet. But we have to keep in mind that begging behaviors are a behavior. And so if you have a pet that comes to you and looks really adorable and is begging for food, and I have a lot of really cute patients, and I'm sure a lot of people listening now, they have a lot of really cute dogs. But if you give them a food item, you've positively reinforced that behavior. That's actually been a light bulb moment for a lot of my pet owners, is that these animals aren't coming to them because they're starving. This is actually a learned behavior that's been positively reinforced in their animal. And so we will often talk about different solutions to be able to manage that in the home. I don't want to take away all treats from dogs. I want to try to manage that within a certain treat allowance. So it may involve the same amount of treats, but maybe smaller treats. So there's a lot of different strategies and ways to be able to handle that. But I think it's really important for owners to recognize that begging behaviors do not mean the pet is starving. They need to recognize that it is actually a learned behavior that has been positively reinforced in a lot of these animals.
I'm going to be very empathetic to dog and cat owners out there, because I remember getting in a fight with our internist at the clinic I used to work at because my cat has severe food allergies. And he bluntly said, the internist said, pets don't need treats. I was like, I know they don't need treats, but I want to give something. So I totally get it.
Yeah, I give my cats treats, and it's funny. My cats they beg. I'm very fortunate that I have a dog that is not a beggar, but part of that is because we have not reinforced that in there. But I did not teach these cats how to beg for food. They are just natural beggars.
It's especially hard. I know we've been talking more about dogs. By the way, I think you guys should do the 14-year study or the longevity study in cats, because we want to know the information in cats. It is a lot harder in cats oftentimes, because oftentimes cats will wake you up at 5 a.m. because they want to be fed. And I will personally say, for me, I want to make sure my cat isn't overweight. So my cat's about a 5 out of 9 body condition score. And in full disclosure, I know this is controversial, especially among internists and among nutritionists, but I actually do feed my cat and one of my dogs with a feeder robot. And I do it where they get an eighth of a cup, or my cat gets an eighth of a cup, starting as early as 4 a.m. So I don't hear the feeder robot going off and my cat doesn't beg. So that for me has been really instrumental in appeasing my cat while letting everybody rest.
That is a strategy that I have had to use as well for some of my clients with cats, because it is important as a veterinarian that when I'm making nutrition recommendations, again, it's not just saying, here, feed this diet, is that we're addressing not only the diet, but we need to address the feeding management in the household too. And so when I'm doing these nutrition assessments on these patients, I'm assessing your pet, I'm assessing what they're currently eating, but I'm also going to ask questions about the environment. And so that actually brings up a really good point.
Last thing that I wanted to talk about on a side tangent when it comes to cats, I know there's several different types of smart litter box monitoring systems out there that can monitor your cat's weight when they use a litter box. And both of my cats both had chronic medical problems going on. One had chronic kidney disease, one had cancer. And so I was one of those crazy cat ladies, which I will fully disclose. I am that way as a veterinarian, but I had it on my Google Calendar where I would weigh both my cats once a month and track it, because I wanted to make sure that they weren't losing weight, they weren't gaining too much weight. And again, that's so much simpler now because technology has gotten better versus like weighing your cat with me and then weighing myself on the scale and doing hard math. But now the technology is out there where you could monitor your cat through these smart litter box monitoring systems. So again, don't forget about cats when it comes to being overweight too. We're going to continue with this really important topic and right back with Dr. Cline right after these messages.
Molly, here's your dinner. Zeus, that's not your food.
Don't let that happen to your precious cat. Elevate your cat's eating experience with the Cat Tree Tray. The Cat Tree Tray keeps your cat's food off the floor and conveniently located on the cat tree. It's the perfect way to eat. It's a beautiful wrought iron tray that easily attaches to your cat tree and keeps dogs and other critters out of your cat's dish. A must for multi-pet households. There's a 6-inch tray for large bowls and a 4-inch tray for smaller bowls. Purchase your Cat Tree Tray today. Go right now to cattreetray.com. That's cattreetray.com. cattreetray.com.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. We've been speaking with Dr. Martha Cline, who's a board-certified veterinary nutritionist, on the importance of keeping our pets, dogs or cats, as healthy as possible. And knowing that almost 60% of dogs out there right now are diagnosed with obesity, we really want to make our pets as healthy and as happy as possible. Now, Dr. Cline, there's no getting around the fact that getting a dog to lose weight requires making changes. And that can feel really overwhelming for a dog owner. As a veterinarian who's studied both the consequences and the solutions for pet obesity, what kind of advice can you offer pet owners out there?
So a lot of pet owners, the ones that make it into my exam room, a lot of them have tried a lot of things on their own. So they've tried to cut back their current diet. They've tried to get their pet to exercise more. They try to cut back treats. And so I know a lot of owners, especially once they start to seek veterinary advice, they've actually tried a lot of things and maybe it hasn't gone so well for them. So the first thing I would say to a pet owner is, one, talk to your veterinarian and ask for their help. There are a lot of great resources and tools that veterinarians have to be able to put together really successful weight management programs for animals. The main key here is the commitment to follow up. And so that's when we go back when I was talking about that readiness to change. And so if you're ready to make some changes in your pet's lifestyle and make some changes in the home, because again, it's not about changing the diet. You also have to look at how you manage the environment as well. But asking for your veterinarian for help is really going to be the first place that I would recommend starting. And we have a lot of really helpful tools to help us in terms of weight management for our dogs specifically, and cats too. We don't want to forget about cats. But the main thing, one of the things that I'll primarily talk to pet owners about are looking at therapeutic weight management diets. And what I really want to emphasize to pet owners is that there is a really big difference between a diet that is being sold over the counter versus a diet that is being sold for a veterinarian. And so veterinarians are going to use a variety of therapeutic diets often to help manage a disease process. And so when we look at therapeutic weight management diets, some of the really important characteristics of these diets, so one of the most important things I'll talk to pet owners about is that we need a diet that has a high nutrient to calorie ratio. And what that means is that I can feed less calories, but I'm not cutting back nutrients. And so if you are going to feed an animal less calories, you don't want them to be protein restricted. You don't want them to be restricted in certain vitamins and minerals. A lot of over-the-counter diets are not formulated to have that type of calorie restriction. And so when you start cutting those diets back, you can actually protein restrict your pet. You can vitamin and mineral restrict that pet. And that just really makes weight loss inefficient, especially when we look at protein. We really want to make sure that we're preserving an animal's lean body mass. And so lean body mass is anything that's not fat mass and is not bone. And that's going to be the most metabolically active tissue. So that's going to be where most of our energy requirements are going to come from. So if we can preserve that, that's going to help preserve that pet's metabolism. That's really important. So that high nutrient to calorie ratio. And then we would also say that high protein to calorie ratio. The other thing that we're going to look at is providing satiety, or that feeling of fullness. So we don't want our pets to feel hungry. We want them to feel satisfied. We want them to like the food that they're eating. The nutrients that provide the most satiety are typically going to be protein and fiber. And so a lot of the therapeutic weight management diets, they may be supplemented with additional fiber, varying degrees of fiber, varying types of fiber. Typically, all of them are going to be high protein. And so those are going to be things that are going to, again, help that animal feel full. And also, again, while we're restricting calories, we're not restricting nutrients. And so I'll have owners and be like, why can't I just use my diet over the counter? Another reason I don't want them to do that is because typically the calorie density is a lot higher. And so that means the animal is not going to be eating a large volume of food, which can affect satiety. A lot of therapeutic weight loss diets are going to be less calorie dense, typically because they have added fiber to them. Sometimes we'll lower the fat content because fat is going to be more calorie dense than protein and carbohydrate. And so again, those things from a dog standpoint are really going to help. On the cat side of things, often we'll employ low carbohydrate diets. Cats actually looking at high moisture diets that can provide satiety as well. So there's different strategies for different animals. And if there's one strategy that maybe isn't working well for an animal, sometimes maybe I would consider something different. We also want to make sure, again, that we're looking at follow-up. And so when I have patients that come to see me, is I will try to book that recheck appointment before they ever walk out the door. So I'm making sure there's some type of accountability. So there's some type of an appointment on the book. And so there are certain veterinary practices that'll have this kind of program already set up. And so if, as a pet owner, I would encourage you to make that appointment before you leave, that follow-up appointment. Justine, you mentioned smart litter box monitoring. So I know getting cats to the veterinarian is really hard. And so we have smart litter box monitors like the Petivity monitor now, where the cats go in the litter box and it'll actually track their weight for them. And so it's something that they don't have to get lugged to the vet every month, which is really difficult for some pet owners. And so there are a lot of really nice strategies on how to do this. The selecting the right diet is really important. I also give treat guidelines. So we don't want treats, the calories from treats and chews and food for medication administration, rewards, any of those things to make up more than 10% of the pet's total calorie intake. So that's really important as well. And then from an exercise standpoint, a lot of owners they appreciate and they want exercise recommendations as well for their pets. For dogs, it's going to be variable because you have to look at, the ability of the dog. If this is one severely affected with osteoarthritis or a dog that has back problems, we kind of have to tailor these recommendations. But sometimes starting is just as simple as 30 minutes 3 times a week. Or increasing whatever activity we're doing by 20 minutes a day. And so those are some simple things that we can do. I do not expect anybody to start taking their dog out for a 5K run. So nobody's training for a race is starting out running the full race on day one. But I do want to emphasize that the diet is going to be the thing that is going to give the most results. And so we want to make sure that we are prioritizing that diet.
Wonderful. Thank you so much. It's so important that you brought that up. My mom's cat was actually on Purina OM, which stands for overweight management.
Mm-hmm.
And sometimes we just need that help with that prescription diet. It was also really important because that cat was middle-aged. And we know in both human and veterinary medicine, as people age and as pets age, they get what they call sarcopenia or muscle wasting, which is one of the reasons why I'm in my 50s and like working out all the time because I don't want to lose that muscle. So again, really, really important that you consult with your veterinarian or a veterinary nutritionist if you're trying to help your pet lose weight, because we want to make sure that we're doing it appropriately. They're on the right diet. We give you as many hints as possible to basically set you up for success, right? Because we have the evidence. We know almost 60% of our pets who are obese, and we know it is linked to a shortened lifespan and to medical problems and osteoarthritis and decreased quality of life. And while I'm guilty of loving my pets too much by feeding them extra treats, again, there's so many things we can do to make them live longer. Dr. Cline, fantastic information. Any last tips that you want to leave with us?
Yeah, so I just want to thank the pet owners who've listened to this. And I think a really fun thing to do is, go home and look at your pet, and you can do your own body condition score on your pet. So there's some really nice resources online on the WSAVA, the World Small Animal Veterinary Association website, on the Purina Institute website, looking at body condition scoring. And then again, just ask your veterinarian for help. There's veterinarians, again, they are trained, they have the skills and they have the tools to be able to make these recommendations for weight management for your pets.
Thank you so much. It truly is a simple thing that we can do at home to make our pets live a happier and healthier life. Dr. Cline, thank you so much. Love what you do and really appreciate such fantastic information.
Thanks for having me.
Well, that brings us to the end of today's show. Find me at drjustinelee.com, on Facebook or Instagram at drjustinelee, or email me your questions at drjustine@petliferadio.com. With that, we're out of time, and we love to thank our guests, Dr. Martha Cline and Mark Winter, our producer, for making this show possible. See you at the next episode.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.